This is Unit 1C, Health Promotion and Maintenance. Oh, let me actually make it full screen so it's easier for you guys to see. Okay. So, infants and children get sick more often because they have an immature immune system, and they also have poor hygiene behaviors, which is normal for being a child. There are two types of immunity. There is active immunity, which is where your immune system develops antibodies, either due to a vaccine or due to exposure to the natural disease. And then there's passive immunity, which is from the mom. So maternal antibodies are passed through either placenta or the breast milk. And protection, this passive protection decreases several months after birth. And the age for administration is actually determined when passive immunity disappears or decreases, is when they will get that vaccine. This is the vaccine recommendation schedule on the CDC website. As we talked about it in class, the CDC updates their recommendations annually. And so this is going to be more up to date than the book. There is a regular schedule, and then there's a catch-up schedule for people that have never gotten them. The way that vaccines work is the vaccine introduces an antigen into the body, which then triggers the immune system, and then your body produces antibodies against the disease, and those antibodies are in your body and will protect you against the disease. I know we talked briefly about the study about vaccines being related to autism and how it was disproven, and how there was financial corruption, but also some parents are now choosing to delay or space out the vaccines. And I just wanted you all to know that there's no evidence to support this. There's no evidence to support them spacing it out. There's no evidence to support delaying the vaccines. So parents are kind of trying to make their own rules up. All right, so DTaP is obviously very important. It is given IM at 2 months of age, 4 months of age, and then 6 months of age. The fourth dose, you get it at 12 months or at 15 to 18 months, and then your fifth dose is from 4 to 6 years of age. Diphtheria, if you don't know, can obstruct your airway. It's a respiratory illness. Pertussis has really tremendously decreased since the introduction of this vaccine. A lot of children used to die from it. It affects the infant's airway, and because the airway is so narrow, they most of the time would stop breathing and die from it. And this vaccine has greatly reduced it. And we also actually, interestingly enough, give Tdap to pregnant women in their third trimester, so that the pertussis, is transferred onto the baby. And then tetanus, about once you get tetanus, there's really nothing you can do. I think like 1 in 10 people die from it. It's a really ferocious disease. So they can't have Tylenol for pain or irritability, or Motrin if they're over 6 months of age. They might have redness and swelling and pain at the site, fever or irritability. If they do have a history of a febrile seizure, you may want to give scheduled Tylenol for this one. Contraindications would only be if they have a neurological disorder or if they are febrile that day. And you can apply a cold compress as needed to the site. Inactivated polio. Polio is a disease that causes fever, sore throat, and eventually ends up in paralysis. Again, this is drastically, I think we pretty much eradicated polio. It's given sub-Q or IM, scheduled at 2 months, 4 months, 12 to 18 months, and then 4 to 6 years old. You might have mild soreness at the site or irritability. Contraindications are only if you've had anaphylaxis to another vaccine or if you have a severe illness that day with or without a fever. MMR, which is measles, mumps, and rubella. This is a live vaccine and it's given sub-Q. It is given at 12 to 15 months and 4 to 6 years old. With measles, you usually develop a high fever up to 105. You're going to have a rash, and it's going to be all over your body and in the mouth. 30% develop pneumonia, which can obviously be very dangerous. Mumps, you're going to have fever, body aches, headache. Rubella, you're going to have a low-grade fever, and the rash starts on the face and the neck. You may develop arthritis from it, and then you actually can shed the virus for up to a year. So obviously this is yet another important vaccine. You might have a fever and a rash, and it might occur about 6 to 12 days, and then it'll last maybe 1 to 2 days. You might have mild swelling of the glands and the cheeks or the neck. And then contraindications are just if you're severely immunocompromised, if you've had prior anaphylaxis to a vaccine, and then if you're pregnant. If you're pregnant, you can't get any live vaccines. Okay, so Hib is given IM. H influenza causes meningitis, epiglottitis, pneumonia, and cellulitis as well. All of these things are obviously horrible, and we've seen a great decrease in the amount of these illnesses. Epiglottitis used to really affect infants as well, which again caused the narrowing of the airway, but we've greatly decreased that. It's given at 2 months, 4 months, 6 months of age, and then between 12 to 15 months. You might have some redness at the injection sites. And then the only contraindication is if you've had anaphylaxis. Pneumococcal is given IM, and this virus typically causes otitis media, bacteremia, pneumonia, and meningitis. It's given at 2 months, 4 months, 6 months, and 12 to 15 months. Might have fever, be fussy, localized swelling and redness. Again, the only contraindication is if you've had prior anaphylactic reactions to other immunizations. Next one is varicella, which is chickenpox. I'm pretty sure you're all familiar with that. So this is also a live vaccine that is given sub-Q, given at 12 to 18 months, and then the second dose is age 4 to 6 years of age. Contraindicated if the child is immunocompromised or they have a staph infection or strep A. They may develop the varicella rash, which is not the same as the chickenpox. It's just kind of this fine red rash, and it could last 5 to 26 days. And then just FYI, if they do develop varicella or get varicella during their childhood, it is contact and airborne precautions for the illness. So hepatitis B is given IM. Hepatitis B usually causes a liver infection, and it often becomes chronic. It's given in a series of 3 shots. The first shot is given at birth or by 2 months of age. Second shot is given 2 to 4 months of age, and the third shot is given 6 to 18 months of age. You might have tenderness at the injection site or a mild temperature. Hepatitis A is also given IM. This also can cause a liver disease, but this one typically doesn't become chronic and can last up to 6 months. First dose is given 12 to 23 months, and then the second dose is given 2 to 18 years of age, and they must be given at least 6 months apart. Again, you might have pain and tenderness at the injection site. Rotavirus is oral. I'm sure you all know what the rotavirus is. It causes vomiting and diarrhea. It's a nasty GI bug. There are so many strains of rotavirus that there's no way we can protect children from all of them. So children are probably still going to get the rotavirus at some point in their life. But we do try to give it to them when they're younger, when they're more at risk for becoming severely dehydrated and needing hospitalization. So there are 3 doses. Give it at 2, 4, and 6 months of age. And we actually don't recommend even starting it if they're at 15 weeks of age or older, just because at that point you can try and orally rehydrate them. It might cause slight vomiting, diarrhea, and irritability, but nothing like the actual disease of rotavirus. MCV4 is given IM. Meningococcal tends to cause meningitis, which can lead to bacteremia, which is obviously very bad. It's given at 11 to 12 years of age, and then you may also get a booster at 16 to 18 years of age. You'll probably get a booster before you go to college. They do recommend it for college students living in dorms just because they're in such close quarters and you're sharing a bathroom and you're sharing showers with people, and so they recommend that they get it. And then it also may be recommended for certain high-risk groups ages 2 to 10 years of age. Again, you might have pain at the site, irritability. This one may cause a headache, but nothing like the meningitis headache or neck pain. And then the only contraindication is prior anaphylaxis to a vaccine. This is Tdap. It's the same as DTaP, just in a different order, and the tetanus is the main ingredient. And it's given at 11 to 12 years of age, and then after that they recommend that you get it every 10 years. However, if you get a contaminated wound or a burn and it's been more than 5 years from your Tdap, since your last Tdap, they may go ahead and just give you another one. That's often a big question in the ER is, when was your last Tdap? HPV is given IM. This is not a required vaccine. It is optional. It can be a little controversial because some people believe that it promotes sexual activity, and it must be administered before sexual activity begins. So the minimum age is about 9 years. So after working in the health department, I would recommend that you get the first dose at 9 years, and then you can get it anywhere from 9 to 26 years. It is a series of 3 shots. You might have pain, redness, swelling at the site, mild fever. Like I said, it is optional. However, HPV can cause cervical, vaginal, vulvar, and penile, anal, and throat cancer, and can also cause genital warts. So if you think about a vaccine preventing cancer, that's pretty amazing and innovative. And so just educate the parents as best you can about what it's actually going to prevent. Contraindications are pregnancy and if you've had an anaphylactic reaction to previous vaccinations. So moving on to dental health. Children usually get their first tooth around 6 to 10 months of age. And basically, once they get a tooth, you can brush that tooth regularly, and it's important that you brush it with a little infant toothbrush. Before they get their teeth, you want to wipe the mouth with a soft washcloth and wash their gums maybe 1 to 2 times a day. So morning and night, just to get that debris off from any food or formula or breast milk or anything that they have in their mouth. You want to make sure the child and the mother, while they're breastfeeding, eat a nutritious diet rich in calcium, complex carbohydrates, and phosphorus. Obviously, decreases concentrated sweets, candy, all of that. Flossing is extremely important. Not everybody realizes that the plaque between your teeth is actually the plaque that builds up in your arteries as well, and so that makes flossing even more important. Sealants may be used to help to prevent cavities. Make sure that they don't have a bottle at bedtime or naps, because that milk or formula just kind of sits in their mouth if they have it and they fall asleep, and that's not good. It can lead to cavities. And they also recommend that you not let them carry the bottle around, because again, they can just use it as kind of a pacifier and not actually drink it. And so again, that formula just kind of sits in their mouth. Make sure they have regular dental checkups. Some dentists recommend that they start to see a dentist at 1 year of age. It just depends on the dentist. It may not be needed until later. And then drink water with fluoride in it, or either use fluoride treatments. This is important. I think I talked about it earlier on, but about if they have well water or public water. Obviously, if they have public water, they're fine. If they have well water, they may have to do fluoride treatments. Injuries, there are charts 7.4 and 7.5 on pages 162 to 163 that talk about injuries. They are the leading cause of death in children over the age of 1. Most of the injuries are preventable and predictable. And the 6 major types of accidents that can cause death and disability are motor vehicle accidents, burns, falls, drownings, suffocation or aspiration, and poisonings. These are the three most common causes of death based on age. I do actually want to briefly just talk about firearm safety. I had a friend who was in middle school. Her dad was a police officer, and she knew the combination. He did lock up his guns, but she knew the combination. And she actually ended up killing herself with firearms. So just be sure if the parents have firearms in the house that you educate the parents on properly locking them up, but also properly locking them up and not letting your children necessarily know where the keys are, what the combination is, if they have any history of mental illness or anything like that. And then I'll talk about education and prevention for the rest of them throughout the slides, but I just wanted to mention that one briefly. Risk factors for injuries in children. They are obviously normally curious, they are impatient, they are also impulsive, they want to master new skills, and they want to be independent. If there is a hazardous environment around them, they will find it and find the hazardous materials. And then a lot of times they will attempt the activities before they are physically and mentally ready. They also like to challenge the rules. They want to have their friends' approval, and they don't really care about their parents' approval. Minorities and children from low-income families are more at risk for injuries because they live in crowded and unsafe surroundings, and lack of safety devices. And then boys are more at risk because they just like to take risk in general. I have 3 older brothers, and they all would do these crazy things as children growing up, and I just sat back and watched. So I definitely know that boys like to take risks. And so if you just want to individually think about what behaviors that these groups each display that would put them more at risk each for injuries. Injury prevention. So really you need to assess their knowledge during the newborn stage, and you need to start planning early. You want to educate both the children and the families, and you want to educate at every visit and start early, like I said. You want to change a child's, like if the child's environment is changed, so if they go to grandparents' house, for example, for the weekend, is their house baby proofed? You may be able to baby proof your house all you want, but if they're going to grandparents' house for the weekend and it's not baby proof, they're more susceptible to injuries. And then legislation or regulation talking about car seats and child safety, and that also has a hand in injury prevention. So like I just said, motor vehicle accidents, you've got infant seats, seat belts, bike safety. You never want to leave a child alone in a car. Every year, there are children during the summer that overheat because they've been left in a car too long. So you never want to do that. Educate the parents on not leaving their child alone in the car. They never know what's going to happen if they go into the grocery store or somewhere like that, and it honestly doesn't take long at all for them to overheat. Wear a helmet while riding a bike or skating. Keep the car doors locked when the car is parked, because the children will try to get in the car and will play around, and it can become a dangerous situation. You want to prevent burns. You want to have active working smoke alarms in your house. You want to reduce the temperature to 120 degrees or lower on that hot water heater. Wear sunscreen, wear non-flammable clothing, turn handles to the back of the stove. We used to have, you also, again, about education and planning, we used to have a ladder that, like a fire escape ladder that we would use if, growing up, we all knew where it was. It was right under the window that we would break to try and get out if something happened. So again, you just want to have a plan and educate the parents and the family and remind them of that plan. Keep electric wires out of reach. Don't let kids play with matches or lighters, and keep fire extinguishers in the home, especially in the kitchen. People usually will have them under their kitchen sink. It's important. Falls, so keep upstairs windows closed. Again, they'll be curious and they're looking outside, and they may climb up and fall out. Use gates at the top and the bottom of the stairs. Keep one hand on the child during diaper changes. So they love to, especially when they can start to roll over, they love to roll over while you're changing their diaper. And so you want to be sure to have a hand on them at least, and then keep the side rails up in the hospital. And if they have side rails on their crib, be sure that they're up. Keep doors locked at an entry to the stairs. If you have any elevated areas, you want to supervise them at the playgrounds, or if they're playing outside, because they're going to climb up to these high areas that they may fall off of and may injure themselves. And then a lot of times with infants that are learning, or babies, toddlers that are crawling and learning to walk, you want to remove those scatter rugs, because they can try to stand up and will trip and fall on those and bust their chin open or whatever. So this talks about drowning. You want to supervise them closely when they're near any source of water, have a fence around a swimming pool, which is, I believe is also a law now. Keep the bathroom door and the lid on the toilet closed. Teach swimming in water safety. So it's interesting because everybody thinks about these, pools and lakes and big bodies of water when it comes to drowning. However, infants only need about an inch of water to drown in. When I was working in the ER, we had a infant, and they're top heavy because of their heads are bigger than the rest of their body. And so the infant could pull up, and the mom was doing some mopping and turned around or walked out of the room or did something. And the infant pulled up, fell into the bucket of water, and actually drowned because she had no way to get out. So when it comes to water, it doesn't have to be a pool or a lake. It can be a bathtub. It can be a very small amount of water. So again, educate the parents on that and keep that in mind as well. Prevention of suffocation, you want to avoid those hot dogs. Cut them up into little pieces. Another interesting story that when I worked in the pediatric ER that dealt with popcorn. We had a 2 to 3 year old who was eating popcorn and then all of a sudden stopped breathing, and nobody knew why. Nobody could tell why. Child came in, we intubated him, did a chest x-ray, and there were popcorn kernels in the child's lungs. And so the child inhaled the popcorn somehow. I guess their epiglottitis didn't close all the way and it went down the wrong tube, went into the child's lungs, and they ended up actually withdrawing life support on the child, and the child ended up dying. So you don't think about these things when you're feeding your child popcorn, but it can be a real danger. And then toys without small removable parts, not only for suffocation here, but also they're going to stick those small removable parts in their ears or their nose, or places that you don't want them to go. And so think about that as well. And then no strings with the pacifier because it can wrap around their neck. You want to check the bed for small objects or cords. We honestly, when I worked in public health, we would teach parenting classes, and we recommended to not have anything in the bed except for maybe a small pillow and then just a light blanket to go over the child, because they honestly don't need anything in that crib besides that. Other things put them at a big risk for suffocation. Keep plastic bags out of reach. Make sure those slits aren't that very wide. You don't want to place the crib by the window because they can pull up, or if you have curtains, they may get tangled up in the curtains, or if you have blinds, they may get tangled up in the blind cords. And no clothing with strings either, because it can get wrapped around their neck. Poisoning, store the product in the original container so that everybody knows what it is. Use child restraint resistant caps, and obviously keep these out of the reach of children. Most people have toxic substances under their sink. You're going to have to move those around if you have a child, or put child proof openings on those cabinets and make sure that they are properly used. And you want to know the number of the local poison center. And like I said, keep it out of reach. Refer to medications actually as medications or drugs, not candy, because then the child will think it's candy and they want more candy. And again, you want to think about the whole picture and about where these children are staying, not just your own house, and childproofing. Like I said all along, education is important, and educating early is important. If you have any questions, let me know.